Welcome, everyone. I'd like to start by acknowledging the traditional owners of the land. For me, I'm on Mingjungbal land of the Bundjalung Nation today, and I'd like to pay my respects to elders past, present and emerging, and acknowledge any Aboriginal people that are with us today. So this is part of a series, which is a partnership between NADA and the New South Wales Ministry of Health, promoting the results of the Early Intervention and Innovation Fund. And today, we're going to hear about the results from the ACON Substance Support Service evaluation, which is an outpatient counselling service for LGBTI people in New South Wales. So I'd like to introduce Professor Martin Holt and Dr. Lauren Brenner to take it away.
Thanks very much, Rob. Thanks for that intro, and thanks to NADA and the Ministry for the opportunity to speak. And I'm hoping that that's in full screen mode now. Yeah, so we've been invited to talk about this evaluation, which was a team effort, and I should first of all acknowledge my list of collaborators there from the University of New South Wales, from ACON, and some of whom can't be with us today, and particularly Toby Lee, who was the architect of this study and the lead researcher. So without further ado, we've already published the results of this evaluation in a report, and I'm happy for the slides to be circulated afterwards. It's publicly available on our website, and it's a pretty long and detailed evaluation. So if you want to know the technical details of what we did and the findings in depth, I'd refer you there. Here, we're going to just try and give you a kind of high-level summary of the main findings and some of the issues we experienced. I'm going to speak first about kind of the study and the quantitative results, and I'm going to hand over to my colleague Lauren to talk about the qualitative findings. So most of you will be familiar with the fact that lesbian, gay, bisexual, trans and intersex people report disproportionately higher rates of alcohol and other drug use, and they may also experience high rates of drug-related harm. Stigma, historical and ongoing stigma towards sexual and gender minorities, creates additional barriers to engaging these populations in alcohol and other drug treatment. In addition, there's limited research internationally on the specifics of treatment and treatment outcomes for LGBTI people, which means there's sort of a poor evidence base for which treatment options actually work, particularly trans and gender diverse people who are increasingly a focus in these programs internationally. Now, ACON, which is Australia's largest LGBTI health organisation, has a long history of community engagement with these populations and has provided substance support treatment in a variety of forms for a number of years and has a specialist service for that. So what we aim to do here is evaluate this service, which is delivered in a number of locations, but primarily in Sydney. And hopefully our colleague, some of our colleagues from ACON may be on the line so they can answer questions if you have them. This is an outpatient counselling service for LGBTI and other sexually and gender diverse people and people affected by HIV who are experiencing problems with alcohol and other drug use. And I'll defer to my ACON colleagues if they want to talk about the specifics of what is offered through that program. Our aim with the funding from the evaluation program was to examine treatment outcomes among ACON's clients, to see if we could assess the degree of reductions in substance use, to see if we could identify improved psychosocial well-being, and also using a range of other methods to see how well the service was engaging with its target groups. So to do this, we had a mixed methods design. We proposed a quantitative analysis of treatment outcomes recorded at ACON through its standard evaluation of how treatment is progressing for its clients. We also conducted in-depth interviews with former clients of the service, with current staff and with key stakeholders, so people who ACON referred to and works with in supporting AOD treatment. ACON also conducted a cost analysis of of the service, which is also included in the report, but I won't be talking about here. The quantitative phase of the study, where we propose somewhat boldly to use client records, and those of you who've worked with client records will know this can be quite challenging. We decided to go back to look at 3 years of client records collected by ACON. And ACON's record keeping, they've worked quite closely following NADA recommendations here on what should be kept, so they can evaluate the success of their service. We did repeated measures, analyses of some key quantitative indicators, many of which you'll recognise, including the severity of dependence scale, quality of life measures, K10, which assesses anxiety and depression, and days of use of the principal drug of concern in the period preceding assessment. And where available, we included client results from baseline and at sessions 4, 8 and 12, depending on how long someone was in treatment. We also aim to do cross-service comparisons between ACON clients and clients attending other NADA, other treatment services that who NADA work with, to sort of have a mainstream sample to compare with. Qualitative phase, the complementary qualitative phase, we conducted interviews between 2018 and 2019 with current and former clients, and also aim to recruit LGBTI clients attending mainstream counselling, AOD counselling services. We recruited via ACON's social media and newsletters, and our aim was to recruit people who had a current or prior experience of outpatient alcohol and other drug counselling at mainstream services. We had 18 staff and key stakeholders who we spoke to, and we used NVivo software and a thematic approach to analysis. I've noted here, and those of you who do evaluation a lot will not be surprised by this, but we experienced an extremely high number of challenges in this project. We had staff changes, we had people having accidents and having to take sick leave. We had trouble extracting data. I think everybody who was involved in this project, including NADA, aged a little bit while doing this project. And so those of you who actually want to read the report in detail, this may not be that obvious from the report, which, you know, we're very pleased with now we've finished, but it was actually quite a challenging process that we had to adapt to as we went through the study. Okay, so I'm going to summarize and then show you visually some of the quantitative results. The mean age of ACON clients who we included was 38 years. And we showed, and we found a number of positive changes, which I'll show you visually in a minute, which will be easier to follow. We found that abstinence from principal drugs of concern in the cohort increased from 14% at treatment and at entry, up to 39% at the 12th session. The number of days that the principal drug of concern was used in the previous 4 weeks dropped considerably, from 8 days at baseline to 4 days at session 4, and then a little higher at 5 days at session 12. We saw reductions in psychological distress, improvements in perceived quality of life between treatment entry and during assessment. However, and something I can't show you, is that we judged that it was not appropriate to compare ACON and mainstream clients. So we did extract that data, and NADA helped us with that, getting that from NADABase. But when we actually looked at the characteristics of the clients at ACON and other services, the first main problem was that gender and sexuality was generally not recorded at mainstream services. This is something that NADA has identified as an issue and has been working with services to encourage them to collect this at least at baseline or when people are enrolled in treatment. And so that was a big problem. We had a lot of missing data there. And then secondly, ignoring that issue, when we looked at things like the employment status, housing, the types of drugs that we used and that clients were experiencing problems with, and how people were referred into treatment, there were major differences between the ACON and mainstream clients. And then we made a decision that it wasn't really appropriate to compare them side by side. So for example, at some of the mainstream services, there were people in unstable housing, no employment to speak of, or they were referred from correctional services to AOG treatment. Whereas at ACON, people generally were voluntarily approached ACON for treatment. And the principal drugs of concern for ACON clients were mainly methamphetamine and alcohol. Okay, so moving on to some of the visual depictions of these changes. So this is the severity of dependence scale, which is internationally recognized, and you can see there a large fall, particularly between baseline and session 8, and then a stabilization. There's a bit of a split here. You can see that the dependence problems were higher for alcohol and a little bit lower for methamphetamine, but and all substances shown in the middle. But yes, you can see that's a substantial and significant decline. If you want the statistical results, please go to the report. Here's quality of life, improving substantially, particularly between baseline and session 4, and then remaining high. Again, it's got we've got a split there showing you clients whose main issue was methamphetamine in red, and with alcohol in green, and everybody in blue. Here's the K10 anxiety depression scale. You can see big falls there, particularly for methamphetamine users. And days of use of the principal drug of concern, large falls there, but particularly a bigger fall, particularly for people who are reporting problems with alcohol. Okay, and now I will hand over to Lauren.
Thank you, Martin. I'm just checking that I put my video on. So I'm going to talk a little bit about the qualitative results. And as Martin mentioned already, we interviewed 22 clients from ACON, past or previous or current clients, and 22 clients and 12 clients who were attending mainstream services. And one of the reasons we added in that sample was because of the difficulties in comparing mainstream to ACON clients in our quantitative sample. So we decided to try and include this in the qualitative sample and just give some insights into clients that weren't attending ACON services. So the majority of our sample identified as gay and were in the age of 40 to 50 years. The majority were white Anglo-Australian, and as Martin mentioned, had methamphetamine and alcohol as the most common drug of concern. So the ACON clients largely reported that they felt very supported going to ACON and that they gained a range of life skills alongside their counselling experiences. And also they really appreciated being at a queer-friendly service. And as Dawn said, my counsellor gives a lot of resources, like would give me podcasts and links to things. So it's an ongoing thing to be supported between sessions rather than go in and then go out. I really like the reception staff and the fact that it's such a queer-friendly office. Like I don't feel awkward being in the waiting room for my therapy appointment. Like with the stigma of mental health and addictions, I tell all my friends to come here. The counsellors have good knowledge about LGBT issues. It's good. So Dawn's quote is quite comprehensive and shows a range of positive factors around the ACON service that is appealing for clients who attend that service. So some of the mainstream clients felt that they weren't necessarily motivated to access a specific tailored LGBTI service because they really emphasized the support that they needed above a tailored service at the point that they went for the counselling. And they looked for low-cost services, but some did say that they were disappointed in the responses to sexual identity in mainstream services. And as Jarrah said, initially when I had a work cover psychologist, he was extremely dismissive in relation to like my identity and stuff like that. Just treated me like horribly. He was like a 90-year-old man and it was just really bizarre. But then I only saw this guy a few times. Then I went to a guy who was bulk billing me. I was really appreciative of the services he was giving me, but they were both like old men that just had pretty much no idea, had their lives and their general life and hadn't looked outside the box. So I definitely would never refer any of my friends on to them ever, even though he bulk billed me and he was such a blessing. At the same time, he was a burden because I was in a fragile place. He was a burden to my mental health. So that just shows a little bit of the difference between Jara's report and the report just before. You can, next slide, thanks. These people attending both ACON and mainstream services tend to suggest that they had a preference for a gay counsellor and they would rather pay than be randomly assigned in a mainstream service. As Antonia said, I would prefer to see a gay one. Through work, you could see a free one, but that's luck of the draw. So I had to pay for mine privately, which is annoying, but I guess it's a good investment. I Googled it, gay counsellor Sydney, and then 2 or 3 popped up, but it's hard to know. It's hard, to shop around, because when you shop around, you have to give them a go. Like 1 or 2 sessions, tell them about the problems again from scratch. And Antonia suggested that if he'd been aware of the free and tailored service offered at ACON, he would definitely have accessed the support there. Next slide. So participants were concerned about the potential discrimination related to their gender or sexual identity, particularly obviously the mainstream clients, but they felt they would be welcomed at a service like ACON. Some mainstream clients did not feel the need to seek out LGBTI services specifically because they felt that social attitudes had changed and they felt comfortable with mainstream services. So there was just a little bit of individual choice and personal attitudes that led to people choosing particular services. Next slide. So some mainstream clients felt that LGBTI specific services were better at addressing the needs of LGBTI people, and specifically in relation to residential services. And this was interesting. Some of the clients felt that public residential rehab services were unsuitable for gay men. And as Brian said, I always thought that they needed a rehab just for gay people. A lot of these private rehabs are good, but they are a bit more relaxed, a bit more comfortable, but the public rehabs can be a bit harsh. And I think what happens is that they can be quite intimidating to a lot of gay men. Like I went to one and it's full on, it's hardcore. You're coming down trying to do all this stuff and they're pretty intense. If someone could come up with a gay rehab, I think they could make a lot of money. Next slide. So generally, participants felt, and it also seemed to be an interpretation of the data, that there was an interplay between LGBTI experiences and their need for specific services or their service choices. And people who particularly wanted a shared or needed a shared experience and solidarity and understanding were more likely to want an LGBT specific service. And that's what made the ACON service really valuable and important for people who wanted that service. So as Shania said, having an LGBTQ counsellor is very important. It takes a lot of courage being where I am and where I live. I'm experiencing a hell of a conflict from my Christian neighbours to the point where I can't park my vehicle on or around my property anymore. Next slide. So ACON clients generally had positive appraisal of the ACON services. They felt that the service must definitely be maintained at the current level or more in terms of what was offered and the quality of the current services. They did feel that the limit on number of sessions could be increased. And there was some concern around confidentiality and anonymity at ACON, but that's because of the nature of the community and perhaps seeing people that they know in the service. But all in all, they felt that these services were excellent and the best thing to do would be to ramp them up. Next slide. So now I'm going to talk a little bit about the stakeholder interviews. As Martin mentioned, there were 18 of them, and they consisted of counsellors or staff at the ACON Substance Support Service. There were staff from other ACON services, and then 12 external stakeholders who worked in a wide range of roles. They were aged between 25 and 61 years, and the majority had been in their role more than 5 years. Next slide. So the perceptions of the stakeholders was that the substance support service was not as well known as it could be among some external professionals. And while ACON was very well known and highly respected within the LGBTI community, with many stakeholders having attended ACON's capacity building and workshops and training events, they felt that knowledge about the substance support service was far less, and there needed to be more marketing around that specific service that ACON offered. Next slide. The stakeholders felt that clients valued the holistic approach at ACON, and that ACON offered a range of services specifically for LGBTI people, and particularly that they were aware, staff there are aware of the minority stress, historical trauma, and the risk of misgendering clients. And as Marion, an ACON staff member, said, trauma, and I mean we are lucky in as much as our particular service has a care coordination team, so the social, financial, and legal aspects that come up for people can be managed. We have a lot of internal support, and that's fortunate because the services that we have in here, it's working across managing all of those things and how they impact on someone's substance use. Next slide. But that all stakeholders, or the majority, felt that there was a definite role for mainstream AOD services to be working with LGBTI clients, particularly because ACON can't service everyone, but that these services needed adequate inclusivity training. As Bob, an external stakeholder, said, we cannot service the whole LGBT community in New South Wales. We cannot do it. We don't have enough. We need mainstream services to jump on board, but I think the only time we should allow them to jump on board is if they've had prior diversity training, particularly the training provided by ACON. Next slide. So for mainstream service, it was important, stakeholders felt, that staff had knowledge, awareness, and training of how to work appropriately with LGBTI people. And this would allow them to attract and engage more LGBTI clients by promoting their service as LGBTI inclusive, and also highlighting training that staff had undertaken. Next slide. ACON staff provided ACON clients provided really good feedback to stakeholders about the substance support program. And ACON was well known among LGBTI communities, again, not the substance support program per se, but ACON generally. And this allowed people to have trust in the various programs on offer, and ACON has a lot of credibility within the community. So as Bobby said, they have a really robust and effective community engagement strategy for marketing all of their programs. So that awareness and understanding within the local LGBTI community should be there. And I think the benefit is the ACON name. People know it and trust it. Next slide. So stakeholder suggestions for service improvement was enhanced promotion of specifically of the substance support program. And that could lead to better interagency communication with referrals from mainstream services to ACON, and also more funding and longer funding cycles. So just to summarize and conclude, going back to the quantitative data, so that analysis showed significant improvements in clients attending the ACON substance support service across the severity of dependence scale on quality of life measures, on K10s, on the K10 and in days of use, reduction in days of use. But it also showed that an analysis of client records is possible and useful for an evaluation, but a comparison with mainstream clients was not possible. It did show us that collecting gender and sexuality at AOD services is highly recommended. And in terms of the qualitative data for the clients, those who had access ACON's substance support service were very satisfied, and they were motivated to attend a tailored service, as this was more likely to meet their particular needs. Clients who attended mainstream services, it was generally satisfactory, but they did feel that it needed more visible signifiers of being LGBTI inclusive, and that staff definitely needs to have more training. Next slide. And health professionals agreed that tailored services specifically for the LGBT community was really important, and it helps in understanding people. They feel more comprehensively understood at those services. However, there's still value in mainstream AOD support for LGBTI clients, but those services need to be equipped to provide a culturally sensitive and appropriate service. So all in all, LGBTI specific services like this ACON substance support service play a very important role in understanding and responding to the health needs of this community and in reducing barriers to accessing services. And the last slide is just our acknowledgements. So these were all the people and organizations involved in the study, and we just wanted to thank them for their involvement. Thank you.
Thank you so much, Lauren and Martin, for your presentation. That was really great. I can see a lot of things that NADA could do in response to the results. I'm not sure if we've got anyone from ACON in participating today that would be happy to answer some questions, because it would be great to hear from ACON to hear what they plan to do with the results as well. I'm not sure if you can let DJ know or alert yourself in the Q&A section. We do have a few minutes. We have 3 minutes left, so please ask some questions for our panel members here. Very disappointing that we couldn't do the comparisons with NADA members, and it's definitely an issue that we're keen to address, looking at how we're going to support members to ask gender and sexuality questions. ACON and NADA have advocated to the AHW for including them in the National Minimum Data Set, and we'll continue to advocate for that. We do have a webinar on the 29th of September called Providing Inclusive AOD Treatment for Gender and Sexuality Diverse People, which is specifically going to look at supporting workers to use inclusive language and support them to ask the questions that are available in NADAbase.
Thanks, Rob. Yes, I know this has been an ongoing discussion about just, you know, we can't evaluate how well services are doing unless we collect the information. I know that some services feel perhaps it's inappropriate, but I kind of think once it becomes normalized for services to collect some of these key indicators, it's quite possible. I can see we've got a question from Libby. Hi, Libby. What does the diversity training for organisations involve? Organisational change is challenging, slow process that needs support from the top down. I agree. Does the training work across all levels? This would be really good if we could actually, I don't know if Sarah or one of our colleagues from ACON, we have some ACON colleagues on the line, but I don't know if they're involved in the diversity training, or how people can put their hands up if they wanted to take that question. We might have to take that question. I don't actually know. Siobhan's got a hand up.
Hi, can you hear me?
Welcome.
Yep, we can hear you.
Thanks, Martin and Lauren. We sound fabulous.
And good outcome.
Yeah. Training. So, sorry, can someone repeat the question?
It was Libby was asking, what does the diversity training for organisations involve? The first part, and then also commenting that it's a challenging and slow process for organisational change, which I suspect we all agree with. But yeah, can you comment on what the diversity training involves?
Yeah. Well, I mean, the diversity training, I guess, is really the foundation for organisational change, and you know, it gives, you know, individuals and organisations the capacity and the tools to start that process, even in minimal ways, to provide, you know, an inclusive and embracing service for LGBTIQ people. The training takes place over a day, where we've adapted the training so it's now being delivered online, and it you know, it covers, I guess, a whole lot of information about the lived experience of LGBTI people in Australia. So there's an you know, historical context, but also a lot of information that hopefully gives people, you know, a deeper cultural understanding, you know, of what it means to belong to, you know, one or many of those communities. And then we look at, you know, what the differences are in terms of substance use in LGBTIQ communities and non-LGBTIQ communities, and why that might be so. You know, obviously there's there are, you know, really common reasons for why people use substances, but there are also some reasons that are very specific to LGBTI communities, and there are also, you know, contexts of use that are different in LGBTI communities. So we look at that and hopefully give people, you know, some tools to, you know, ask the right questions and start to have the conversations that are going to be useful and meaningful for people trying to, you know, trying to reduce, trying to manage, you know, or trying to quit, you know, their particular substance of choice.
Thanks, Siobhan.
Thank you so much, Siobhan. Sorry, we're a little bit over time. I do notice that someone from ACON has put in the website, or I'm assuming they're from ACON, that someone has put in a link to that Pride and Diversity training down there. So I do encourage people to look at that. Pip's also asked a question around risks in the recommendations. And Pip, I would direct you to an e-learning module that's on the NADA website that ACON developed, which has people from the LGBTI community talking about why it's important to ask those questions. And I think that would alleviate any risks. I think the strengths outweigh the risks. We do need to finish, so I'll thank our panelists, and I'm sure we can get people in contact with either Lauren, Martin, or Siobhan, or another member of the ACON team if anyone has any further questions. So thank you. The next webinar in part of this series is on next Friday, which is looking at the feasibility of adolescent AOD interventions in headspace centres, and then followed by an evaluation of cognitive remediation therapy among people in residential treatment for substance dependence. So please join us then. And thanks again to our presenters.
Thank you.